I'm going to try and keep it strictly on Medicare also. Let me just jump a little bit. You know, people that don't remember history have to pay the consequences. And in the tradition of the Locke and Smith Foundation, go back to 1600, and the British government set the price on a loaf of bread, a ton of coal, and a day's labor. And it just was a horrible economy. You had the Black Death comes through, got half as many laborers, but the cost for a day's labor is still the same thing. And finally, eventually, the British figured out we don't want the government setting prices and everything. Of course, we haven't figured this out yet. So you got Medicare, and the government's setting all of these different prices. So I think probably one of the very first things we want to do is to deal with that question. So what we've done is we've created an economic mess by the government setting prices. The next thing, though, is it's worse than that. It's not just lousy economy. It's actually rationing and what could potentially become the equivalent of people choosing whether you live or die. Because we've put this thing called an IPAB board into Medicare, and what that is it's 15 people unelected that decide how we're going to control costs. Oh, how are we going to do that? Well, Congressman Akin, you're too old to get the hip replacement, or your grandfather finds out he's too old to get a heart bypass. And so using rationing and the government in that regard is just terrible. Then in addition, what we've done is taken $500 billion out of Medicare. That's not a very smart thing to do. So what are the solutions to this problem? I think the first solution is something that, as a member of the Budget Committee, that Ryan and a bunch of others of us put forward as a starter. And that is, let's get rid at least of the price-setting mechanisms. And instead of the government setting prices for everything, we simply allow a whole series of providers to provide health coverage. And the person that's on Medicare can choose the provider they want for the kind of services that they provide. And if they don't like it, they can change to someone else. So first of all, you get rid of the price setting. Hopefully we repeal Obamacare so you don't have this IPAB and the $500 billion mess in here. So that'd be the first thing, would be get rid of the price setting and to do that more through a multitude of providers. I think the second thing that's helpful too is the idea of that you could have medical savings accounts, because now you're moving back toward a market-based system with Medicare. So all of those things, I think, would get us going in the right direction. Your assumptions are completely right. And Dr. Lilly, I'm extremely concerned because we're giving the impression that these programs will continue and everything's going to be okay. And our elected leadership is lying to the public when they say that. These things are fundamentally broken. If we're going to keep them running in some semblance, they're going to have to be changed. I think the free market model is the way to go. Thank you.
Thank you.